Thank you, Emer. Hello, everybody. Welcome to today's webinar session. As Emer introduced, healthcare data management, why it is so important. And my name is Deirdre Feehely. I'm newly appointed to the South West Hospital Group as the Nursing and Midwifery Information Officer. Data and its management and healthcare is essential and is very topical at the moment. I know from my nursing background that healthcare data management, when optimal, creates holistic views of patients, improves communication and aids patient flow and the continuum of care and enhances patient-centred care. Access to timely, quality, complete and accurate data is essential in healthcare, and its management is equally essential. It's particularly evident recently in the COVID pandemic, which we were all familiar with. We saw how timely access to complete data both guided and informed public health teams to make critical decisions and to flatten the curve. And we have a very experienced panelist of three this afternoon, and I'll introduce you to the three. Hazel Chappell is the founder and digital manager partner at ishca Health, followed by William O'Brien, Director of Cybersecurity at PwC, and Professor Donal Sexton, who is a consultant nephrologist, clinical associate professor at Trinity College Dublin.
I think we just lost Deirdre there for a second. So if you just want to introduce yourselves first, and then we can come back to Deirdre. So maybe Hazel, if you want to go ahead.
Okay, thank you. I'm a massive fan of nursing and their informatics and what they're actually bringing to healthcare today. So it's wonderful to have Deirdre, and I'm delighted to be joining on the panel today with my esteemed colleagues and friends. So I'm Hazel Chappell. As Deirdre said, I'm founder, CEO, digital managing partner at ishca Health. I'm based here in Austin, Texas, and the Texans love my story around ishca Health and what that word means in Ireland. Water, one of the basic needs of health, one of the basic needs of life to be healthy. So I have 20 years in experience, or 20 years experience in healthcare, and more recently within the bioscience. I have deep expertise in the business of change, and for some of you who do know that, I sat on eHealth Ireland board in the position of advisor on the need for change management in Ireland back in the days when Richard Corbridge was CIO. I'm an executive advisor to startups and healthcare leadership, and that can range anything from bioscience, biotechnology, right through to biomedicine. So on that, I'm an advocate for innovation and in healthcare and for disruptive technologies as well. My experience in cybersecurity came about at an unexpected time. Just some years ago when I came to America, I was invited to be part of a due diligence initiative, which is what with the innovation and investment arm of the American Medical Association, and our remit was to go across America and check out and see, we know there are problems, we know there are solutions, let's validate them and let's look and actually see what's better. So that brought me into a very broad audience and experts within the world of cybersecurity and healthcare, right up through to Homeland Security and other organizations. On that aspect, I had the privilege of writing a proposal with the former CIO of the Health and Human Services, who was responsible for protecting and defending Operation Warp Speed when COVID started, and combined with the former Assistant Deputy Secretary of Health, Eric D. Horgan, we had a proposal to bring to Ireland together and how we can help when last May kicked in Ireland. That offer is still there if it's to be taken up, about the deep expertise. And I guess lastly then, some of my passions on a professional side are all around data, humanizing change, and on a personal level, it's about cows and longhorns here in Texas.
Thank you, Hazel. Apologies, I dropped off earlier, and hopefully my connection will be stable for the rest of the webinar. Moving on to William, it could give you an opportunity to introduce yourself and tell us about your organisation and your particular interest in healthcare data management, why it's important to you.
Great, thanks Deirdre, and good afternoon everyone. Delighted to be here with you. My name is William O'Brien. I've been working in information technology and security for almost 20 years now, specializing in forensic technology and cybersecurity for the last 12 years or so. I'm currently a director of cybersecurity at PwC, and I lead out on our threat intelligence and cyber incident response function. I suppose, look, like everyone, you know, I can see everyone sees the value of healthcare at the time of need. I suppose I was a part of the PwC team that supported the HSE in a post-incident review on their cyber attack, which occurred in May of 2021. So I saw the impact that cyber attack had on the HSE, and to their credit, they published our report, which was a post-incident review of that attack in December of 2021. So look, yeah, as I said, delighted to be here with you all this afternoon, and hopefully I'm looking forward to sharing my experience with you in the area of information technology, data management and information security, and I hope it'll be of value to you from the session. So thanks, Deirdre.
Yeah, thank you, William. And nextly, I'm Donal Sexton. If you'd just like to give us a brief introduction about your organisation, your interest in data and healthcare management.
Sure, thanks, Deirdre. So, thanks for the opportunity to hear today. So, Donal Sexton, I'm a consultant nephrologist in St. James's, which is basically a kidney doctor looking after people with kidney failure and dialysis and transplants, kidney transplants. But then in the research component with Trinity, I'm involved in some epidemiological studies, and then also machine learning and artificial intelligence analysis research of human healthcare data with the TILDA study. And within St. James's, one of the reasons why we're kind of more focused on data is that St. James's was the first hospital in the country to have electronic patient records since about 2018 to use Cerner. So there's a lot of momentum and kind of desire within St. James's to create a data infrastructure, sort of the data lake, to allow the data to be used or harnessed, you know, for novel insights and for patient care as well. But there's obviously a lot of different elements to that as well, but it's obviously falls into the bracket of healthcare data management.
Thank you very much, Donal. Just to open up the conversation, lessons learned from the HSE cyber attack May 2021 highlight the need to stabilise storage and protect data healthcare, often which comes from diverse sources. Hazel, I'll start with you because I know you were involved in informing local decision makers prior to the attack. Can I ask, what are your thoughts on Ireland's public institutions' preparedness for another cyber attack?
Yeah, that's a great question, and you're right. Actually, I had opened up conversations prior to the attack coming because of what I had seen coming from America and the tsunami. But as Ryan Tubridy once said, hindsight's a wonderful thing and foresight is better. So I guess actually, in answer to your question, I'll ask questions which will provoke the thinking. Is healthcare really prioritised as a critical infrastructure? And the reason I ask that is because I see certain events. So, for example, you know, and I'm very happy to be wrong. And by the way, I'm very, I want to share that it's my opinion, and, you know, I am across the water. But even looking at the cyber event next week in Cork, I'm looking for an agenda on healthcare, and I'm not seeing that. My next question is, has emergency planning and preparedness been developed and made available to all health entities and organisations, public and privately? Now, the reason I ask that is I am actually involved and produced a document around that from America that actually crosses whether it's hurricanes or whether it is actually around cyber security. And that is a meaty piece of work to have as basic guidance. I guess my next question as well is, and I don't know the answer, is who is the expert for cybersecurity in healthcare in Ireland within a health entity? You know, kind of whether it's in government or across the board or as an appointed leader. And I guess really my last question is, how confident are we of our update to data intelligence in real time? We know, and William spoke earlier about actually harnessing that information globally and what's going on is a massive, massive piece of work for any CISO in place or whatever. But how confident are we that we have enough intel up to date to take an offensive position rather than actually continue to defend and take a position of resilience?
So I'll open that up. William, do you want to add anything to that or reply to any of those questions at this point?
Yeah, like, look, it's a good question. I think I would say, look, there's a lot done more to do. I think, look, just you mentioned the HSE attack. I think the HSE deserve a lot of credit. Shortly after the attack, they commissioned the post-incident review. But we were probably about halfway through that review, and the leadership of the HSE said that they actually wanted to publish the report. And I think that was a massive step and a very brave step by the organization to take, and they deserve a lot of credit for that, because I think a lot of the learnings that came from the post-incident review, they recognized that they could be shared both within the public sector, but also the private sector. And I think that was kind of a watershed moment for a lot of organizations in the public and private sector. Our phone certainly started ringing in PwC. We work with a lot of healthcare organizations. We also work with a lot of private organizations as well. And like what Hazel was saying, before that attack, we had been speaking to a lot of organizations, executives, boards, and our messages on occasion were falling on deaf ears. But I think since the attack and since the report that was published by the HSE, the tone has changed, and that was one of the key learnings from the post-incident review of the cyber attack in the HSE was the importance of governance and cybersecurity leadership and setting the tone from the top. And I think, like, it's once that tone is set within the organization, organizations are now starting to understand, I suppose, the importance of effective cybersecurity capability, and the importance of being able to respond to an attack. So a lot of people will be aware, it's not if, but when. But like every organization, I think the public will accept that you can become targeted and subject to an attack. But I think organizations will be judged on how they respond, and that goes not just from a technical response, but obviously leadership from within an organization, to communication to the public and key stakeholders. So again, look, I think some organizations have been keeping up to date with this. It is cybersecurity is a very broad area, but I think others have more to do. But I think it's really that tone and leadership that a lot of organizations are now starting to take. Are seeing organizations better prepared. But look, not everyone is at that benchmark just yet.
And Donal, have you anything to add? It's been like a two-pronged approach. You're working on the front line as a consultant, you're also done research. What are your thoughts on our preparedness for another cyber attack?
Yeah, I agree with the tone has changed, definitely better than they were, but obviously, yeah, I mean, the lesson will be that, so St. James's, because there's an electronic health record, we have a very good department here called IMS with the information systems who are focused on that. So during that cyber attack, St. James's was able to kind of continue, essentially business as usual, because it wasn't as affected, because it had more up-to-date systems, and essentially had was less vulnerable, which I think was a lesson to other hospitals as well, in that there's a future, like obviously we need funding for to switch to electronic systems, but there's obviously more dedicated security around those systems that are much less susceptible to malware and things. But it was, the older system, the hospitals that were relying on these older systems, and one of the other problems that obviously different hospitals are using different systems. There was no real one culprit. But I think that was a major lesson that the HIHI learned. But I do agree with William that they now, having recognised how real the threat is, I think they are starting to invest in it, and I think the preparedness will definitely be better for the next one, or going forward, as it probably happens to some degree every day. But they would be the kind of the major lessons. Yeah, but some hospitals were very disrupted just by the downtime of having to shut down the system. So a lot of patients were impacted by that. Appointments cancelled, surgeries cancelled, cancer treatments cancelled, so it did have a massive impact, not just the kind of the theft of the information, but also the actual disruption to the response that was needed in order to shut down the systems.
Yeah, thank you, Donal. I think it's important to acknowledge the response from the HSE, both the frontline, the ICT. They were very agile and resilient in their response to the attack, and to keep the healthcare system going at a critical time. So we're getting a picture for the big challenges associated with healthcare data management. Hazel, yourself again, what would be the biggest challenges in your opinion?
Well, in no particular order, in my opinion, certainly ethics and biases. This is a big beast around the data management and availability, and to understand, these new words that are coming on board, like beneficence, and is it helpful to people that it's used or whatever. So I had the privilege of speaking with a professor in UT Southwestern here in Dallas, who was brought over from Austria to lead on this. And it's one of these things, we don't know what we don't know until we're opened up to it. And that is something that will become absolutely a big bubble sooner rather than later, more than words. Another thing as well, I guess really what I'm thinking about is the traceability and trust of data and access to that, and what that means. So, where it comes from, how do we know about the quality of it, and really the whole journey from the data, the information, the knowledge, and using that. And even though organizations, in my opinion, and it doesn't matter where we're placed in the world, that while they may have policies and everything in place, but it's actually at the end of the day, it's about who accesses with the clinical interest on that, and lots of other elements associated with that. To me as well, I think there's a challenge around the understanding of language. So when we talk about, I know Donal said specifically artificial intelligence, people talk about AI, and I will tell you, 20 years ago when I started in healthcare, AI had a very different meaning within the farming world to now. Now we talk about AI, and is it artificial intelligence, augmented intelligence, or is it, actionable insights? And when you take this language, and when we talk about insights, and it can be descriptive, predictive, diagnostic, really are we all talking the same language at the end of the day? And that is something, I'll throw the last example in, interoperability. Does that mean reciprocity? Does it mean access to data? Does it actually mean sharing of data? And to me, I think it's hugely important to have that level playing field of language around. I guess one of my final thing, yet again, I think I know the answer, but it's something that I have seen effective. I facilitated conversations here is, does Ireland have a chief data officer? So I've been an educator to the chief data officer here within Texas, and sharing the need to understand the benefits of what the change management aspect to data management. And to me, that will be a challenge by not having one in place. And they're my thoughts.
Yeah, Thank you. Just moving over now back again to Donal, from the front line, your experience of dealing with EHRs, what are your challenges associated with healthcare data management?
So what St James's has a chief information officer who's Dr. Deirdre O'Donnell. She's an oncologist with, part of her role is the kind of overseeing the EHR implementation things. But so the challenges are, as Hazel said, the same thing. It's the security of the data. So obviously the hospital's very focused on securing the data as well. But then to use the data, let's say for research and things, one of the biggest challenges will be the ethical use of it. Consent. How do you get the consent? Retrospectively, prospectively, for the use of data, and then obviously things like analyzing the information. So whether it's for improving patient care for people who pass through St James's, or producing novel insights that would influence kind of healthcare, nationally or internationally. All that needs to be kind of figured out through kind of data governance structures and legislation as well. And obviously, so there is a movement within St James's to try and figure those things out for the ethical use of data, whether it's, let's say, machine learning or AI, and then obviously communication with the public as well. So there's also kind of an initiative that's not yet funded, but to look at things like citizen juries and things with the group IPOSA, which so the public's involvement will be very important as well when it comes to data use. But they are the challenges. Just like Hazel articulated.
I take your point about data governance being essential, especially in both at a local level and internally for the hospital, and nationally the governance of it is essential. There is a data protection officer appointed in the HSE, Johnny Farrell, who's contactable on DPO at hsc.ie, and there are equally deputy data protection officers associated with each healthcare area, and that's up on the HSE website, and we can forward that detail to you afterwards if needs be. William, just from your background, while we're still on the area of cybersecurity and cyber attacks, what were your key learnings at a high level? Any other key learnings just before we close off in that area?
Yeah, look, I might just kind of go back on something kind of Hazel said. She kind of mentioned the use of language was really important, and I suppose when you asked the original question, I was thinking, the thing that popped into my head was communication, and then Hazel mentioned language. I think, look, there's a significant gap. I suppose data management, IT, information security. It is a kind of a complex and challenging area, right? So from a communication perspective, there's often a gap between the executive and board and their understanding versus, for example, a head of IT or a head of information security. So I think there's a challenge for both sides of the fence, and I think from an executive and board perspective, this is a major risk. IT and IT information security is a major risk for every organization. And I think it's up to executives and boards to increase their understanding in the area of data management, information technology, and information security. But I'd also challenge then, say, for example, chief information technology officers and security officers, that they need to actually learn to translate the complex areas into plain and simple speak, and like, look, it's no different to healthcare. I think we all remember in our lives that the doctors or the nurses that you've met that could communicate clearly and simplify a message quite clearly to you, and again, that just demonstrates care and empathy as well. So I think communication is a key point. Donal touched on kind of governance, and I think that's really important. But I think, like, a key learning kind of for me, especially coming out of the HSE cyber attack and working with other organizations since, is that I think effectively, in terms of helping communication, is that organizations should be challenging themselves to undertake kind of like current state assessments of both their IT infrastructure and their information security. And there are really good global benchmarks out there, and organizations in the healthcare arena can be benchmarked against their peers. And what that really helps is you're taking kind of a technical area, but everyone understands benchmarking, and especially against peer organizations. And if you're analyzing yourself against your peers and your maturity is behind them, you know you've more work to do, and it can really help, I suppose, the executive and leadership make investments in key areas. And like what we find is, by helping organizations with kind of current state assessments and benchmarking against peers, is that you can then give an organization a clear path to improvement to enhance their overall information technology and security maturity. And what we found is that when we conduct those assessments, you know, give them back their benchmarking scoring, that communication barrier that was previously there is broken down, because everyone now has a clear direction of travel. So again, that's probably one of the key learnings I found from the cyber attack in the HSE, to again help bridge that gap between the technical audience and the non-technical audience within an organization.
So I see from the panelists there's vast experience, and you're globally spread across the world as well, and there's more further opportunity to seek out like why your thoughts on data healthcare management. Like for you, why is it important? Where are we at now? Where do you think the future of data healthcare management will go? Hazel, if I'll open that up to you, what is the future for data healthcare management?
We're, in terms of, well, we've gone from, I guess, with the new technologies that are coming on board, so whether it's RPM, remote patient monitoring, never mind management, and then actually looking at, I suppose, smart cities or smart hospitals and smart cities and all of this, we're now beginning to look at the need for data management in a broader spectrum and a more secure. We're also as well, you know, I see things coming along the line now about patient matching to be a big problem, and that has to be fixed. So therefore, to have identity access management in place is going to be a big player in as part of this. So think about actually having our face as our identity, just like we do in travel and everything. In terms of AI and are the different models understood, and where does that actually bring? Also, we need to look as well in terms of, are we actually linking policy, patient needs and standards to develop the strategy for data and information? Now, I guess really not necessarily a bolt-on, but in terms of more around the security of data, I've been in conversations where blockchain in healthcare is becoming absolutely, it's coming on with an avalanche, because it's not a case of if, it's going to be when. And then when you actually take the recent mandate from the White House about bringing in quantum computing to enhance that security as well. This is technology in terms of, you know, and I'm not a technologist, and we hear about the metaverse, and what does that actually mean? Is it going to go from a social platform right up through the company and the warehouse? So this is coming fast and quick, and I guess really then does it tie back to the first question, how ready and prepared, you know, is well, country per country or whatever for this. So it is a big, it's a small question, it's a big beast.
Yeah, I absolutely agree. William, I'm sure you can add to that. Where do you think we're going in the future?
Yeah, certainly a big beast. But I think like that. You know, I think looking at even other sectors, you know, outside of healthcare, you know, I think, like, you know, for example, in you know, in the financial services sector, they want that single view of customer, and I think the expectation of any customer now dealing with a financial institution is that you'll have a single view of all your information, and I think that's the expectation of a customer dealing with a financial institution. But I think that will become the expectation of a patient, having that single view of all their records and history. And I'll just give you an example of related to healthcare, and it's a personal example. My brother's an accountant, so he often helps me with my year-end tax return, and he quite recently in the past week he's been asking me to get my my medical bills for the last 12 months, and for example even my wife, she had a baby earlier this year. So again, I was able to log into our healthcare app, get all the receipts that I had uploaded within that healthcare app for 2021 on one single view system. And again, that just made my life a hell of a lot easier for a year-end tax return for 2021. So I think it's about having that kind of single patient view. But again, as Hazel said, it's a big beast. It's by no means easy. It is complex, but I think that's the journey we're going on.
And certainly healthcare is undergoing a lot of transformation with Sloan to Care, and we're empowering patients to stay well at home. And we need to look at the patient data. The patient owns that data. We need to provide access to that data. We need to have trust and reliability in the data that's being provided. If we are to promote wellness and promoting the patient or the person being a citizen rather than a patient, keeping them well in the community. Donal, have you any thoughts or any comments to add?
Yeah, so I agree with everything that everyone said there. Yeah, and there is a movement. Martin Curley in the Digital Transformation Office. Their office actually funded a pilot app that we have here in the renal department that our patients use. It basically we use it to communicate with them. It actually is very much kind of improved the communication network from rather than them having to call secretaries and not being able to get through because the phone is busy. But he also there is that kind of utopian idea of possibly having your patient passport, so like everything would be all of their information in one place, and if they move from here to Limerick, they bring all that with that, potentially through portals and apps and things. But so, yeah, there is a kind of a movement working towards that stuff.
I might encourage the audience. I know we've over 50 attendees. If anyone would like to ask questions, feel free to type them in, and we'll try to come to those at the end. Yeah, Hazel, did you want to add anything about the future of where we're going with data healthcare management? Have you any further thoughts?
Well, actually, if I could pick up on something that Donal just said in terms of having access to that patient record. So I said earlier, I worked in healthcare for over 20 years. And so I started when implementing electronic health records, when data and understanding the value of data was not as clear as it is now. We talk about data as an asset. So when I was educating clinicians to how to code effectively, now they would decide whether what the diagnosis or whatever the case would be, because that's what they do. They're the clinicians. But understanding actually whether it was a diagnosis code or whether it was an assessment code, and actually now building up to what Donal's talking about, the data lake, and understanding, I suppose, really trust around that data, which is quality of content within the electronic patient record. And then I had experience in implementing within the NHS, enabling users, patients have access to their data. And then when we actually look about subjects access requests, so it's called redacting data. So basically and correct me Donal if I'm wrong, but you make so much available the data for visibility, because for lots of reasons, whether it's mental health or it's whether you understand something to be very different than I do, it is really in everybody's interest that clear information is made available. So to have access, as William was saying, to have what was called one patient, one record, in England at the time now, is really going to empower the patient. And that's one thing that, you know, when you take an organisation like a PwC in Ireland that is purely patient-centric, and it really is encouraging the patient to be empowered and understand their data quality content. I'm the first to advocate, go and look at what your coding is, because do you have an assessment code or do you have a diagnosis code? That can impact you as well when it comes to insurance or other information. You know, I live in a world, a litigious world here in America, so you know, it's no harm about hedging that. And then, as William said, we're going to get a bigger, you know, when we're actually looking at public health, we all now go with public health. So within Ireland, it's within the HSE. There is an inordinate amount of private healthcare providers coming into Ireland, which, if we need health in this world, we're going to go down there as well. So how do we merge that data together? So therefore, I see there's a great need to actually collaborate private and publicly together, which is exactly was the basis for Eric D. Horgan's keynote at last November's Future Health Summit in Dublin. There is a need to harness this, you know, at a higher level, because then we're talking about a more holistic view for every one of us, because at the end of the day, we are all patients as well. So in terms of the future of data management, it needs to come from the top, it needs to come up from us, from the patients up, and actually help us policy and legislation together as well. And that includes around the world of telehealth as well, which in my opinion is going to be much, much more prevalent. Unfortunately, and I'll finish on this note, unfortunately in Ireland, when you take an organisation like St James's, which is in my opinion an arguably iconic organisation, there are actually other what's called social determinants of health rurally in the country that don't have access, whether it's technology, broadband, or anything else. And these are the challenges that I see, but it's where the future is going, because who wouldn't want telehealth, you know, especially with the new children's hospital coming up and, you know, for the sick children.
Absolutely. We've heard numerous accounts now of how complex healthcare data management is. It's also expensive. I read recently that it can take up to 30% of the overall healthcare budget to manage it. So it is complex and expensive. I'm just wondering, what advice would you give to startup companies with regard to data management? Maybe William, if you'd like to open that up.
Yeah, like, look, I think for any startup, you know, I think it's just realizing the importance of data. So again, your own intellectual property, your IP, but also the importance that if you're going to be dealing with patients and personal information, the importance of actually as a data controller of protecting that information. So like I'd be kind of taking a risk-based approach and ensuring that, you know, you're empowering yourself with knowledge to minimize your risk. So for example, you know, if you're designing, for example, a healthcare app, you know, you may be, you know, dealing with third parties providers to support you in that. And you may be using, for example, cloud to host your data. You really need to kind of empower yourself to be able to ask the challenging questions of your third parties and cloud storage providers and it's as simple as just understanding where your data has been hosted, where it's been replicated, how it's been backed up, and how easily can you actually retain the data. Should you wish to transfer to another provider, or should you actually should they be impacted by a cyber attack, for example? So I think it's really about kind of, you know, just sitting down, you know, just pulling out a pen and paper and just mapping out, you know, how your data is traveling. Then looking at your key dependencies, both internally within an organization and then externally, and asking those questions, and then ensuring that, for example, if you are dealing with third parties and they are managing your data on their behalf, you know, ensuring that they are having, you know, regular pen testing, regular assessments for ransomware attacks, and obviously, you know, certifications such as ISO can be really important to give you comfort that an organization is putting in robust and rigorous controls to manage your data.
Thank you, William. And Hazel, would you have any advice for startup companies?
I have lots of advice because it's a key area that we you know, that we focus on at ishca Health, which is actually something that I forgot to say in the beginning. So we do executive advisory and consulting to organizations. So anything from startups right through to more mature organizations, focusing on the non-technology. So it's about the workforce, including patients as well. So I'm going to recap on some of the things that William said, that, well, I can give advice today on what startups. We delve deep into showing them how to actually develop these areas. Governance, absolute must. That is absolutely imperative. If they don't get that right, I can confidently say, or at least have it as a big consideration, it can set them up for failure from the outset. A little bit of coaching to CEOs: be curious, remain curious. Always be curious about everything, even what do you mean by being curious? And that is one of the things that will most inform you as well, whether it's directly relevant to the solution that you're bringing to market, or whether it's just part of being actually a you know, a startup. I've been an advisor and mentor to the GRIT program that's been spearheaded by Diane Nevin, as well as I'm a business advisor to UT Del Med here in town, and big initiatives in North Texas as well. So I eat, sleep and drink what startups are about. Another area as well is consider scaling up. This is absolutely important. Organizations startups don't always factor what does that mean. Whether it is actually just putting it on a plan, what are your expectations for when actually, whether it's an implementation or whether you use your innovation, you know, within the, I was going to say emergency room or operating theatre or whatever the case that may be. Absolutely, William spoke about mapping the journey of your data. I speak to startups the whole time, and when I talk to them, they go, well, we don't hold any electronic patient health information, EPHI. However, every startup has data in some capacity. And what does that mean? I'll throw in, I think it's becoming now a very common phrase, cyber hygiene is as important as hand hygiene. Let's not go back 2.5 years ago, but that in essence is the truth. I said earlier, hindsight's one thing, foresight's better. These are really important areas of information. And as I say, it's about actually, in terms of data, it is, as a startup, going to be your biggest asset, because what I tell my students when I'm guest speaker, you know, at various universities, what if your data is lost or stolen?
I might just add to that as well. I think it was just very interesting. We were helping an organization with a ransomware attack recently, and as we were kind of brainstorming in terms of the incident response, so again, they were locked out of all their systems, you know, locked out of all their data, and it was a real challenging time for the organization. We started to kind of whiteboard and map out, you know, their systems, their servers, where they were storing data in the cloud, and we had the CEO in the room, and like his comment was, this is the first time I actually understand how all of this operates for running our business. So again, it's just preparing, you know, so preparing, I think Hazel made a great point, preparing for scaling, right? And I think every new business will want to scale, and have that, they should have that ambition. But again, it's preparation is the key for managing your data. And the Alex Ferguson saying, fail to prepare, prepare to fail. So again, preparation is the key.
And Donal, as a clinician dealing with startup companies, what would your priorities be and your concerns with regard to data healthcare management?
Yeah, I guess, well, definitely the tighter the security protocols, the kind of easier it is to imagine, to work with healthcare companies or startups, because that's always the fear, is that there's going to be a data breach, patients' data is going to be breached. So that, I suppose, I don't know too much about the startups, but I imagine from a clinician point of view, the tighter the startup can show what their data security is in terms of healthcare data, then that's going to influence how willing people are to engage.
This is a very insightful conversation, and the time is running by. I'm conscious there are a few questions popping up that we might start to look at. Judy Collin there mentioned that lots of data. How does it get organised into safe, trustworthy information? I know from my own experience in the HSE that we are looking to use data sets and to work towards that process. And there's a data set specification management process, which is run in conjunction with SNOMED and the with eHealth Ireland, and there's a whole process and structure there where Teresa Barry is the SNOMED lead, and she heads that up and works through that and works closely with HIHI to ensure that the data sets that were used aren't being recreated or being overworked, and that they're quality, that they're of the required standard. So I'm just, if Hazel, if you have anything to add to that.
So yes, I do. It's just about actually circling my thoughts. So to me, there's a journey of how we actually get to the point of using data that I'll go back to for AI, actionable insights or whatever. So we have the data, and then we need to start looking at actually the information. What is that data? Then we start learning and maybe start getting trends, and there's knowledge about it, which is when, from what I see, then there are insights. And I mentioned earlier, insights can be broken down into descriptive, diagnostic, predictive, and prescriptive. I'm not going to get into the bones of that, but then it's the wisdom that we use with that. So, it's like, well, we know a tomato is a fruit, but it's the wisdom to put it into the fruit bowl or not. So there's the journey of that, which comes back really from the data that we have. Do we trust it? And that's why, unfortunately, Deirdre, technology-wise, you got cut off at the very beginning. When I did my first digital transformation effort in a big hospital in London, it was actually the nurses that I wanted to champion first, because exactly of their observation and the trust of the data that they took and pushing it in there. And I will never be shy in advocating that while informatics are great, but nursing informatics, to your point. So there's the science behind, of course, that's why we have these new jobs coming out that, and I will, innocently say it's people like me know so much, but just that's why we have the experts, like William in cybersecurity technology, and the clinicians within their field to actually work this out and help us to make those decisive insights.
William, have you anything? Would you like to add to that?
Yeah. I suppose, look, it's a good question. It's probably not an easy answer, right? But I think you need to look at data through two different lenses. You've got your structured data, which is your database information, and then you've got your kind of unstructured data, which is your email, your file shares, your document stores like SharePoint. So again, I think for any organization, it's about ensuring that you're building your solid foundation within those two areas. And I suppose it's about understanding for any organization is where is your critical data from a value perspective to the organization stored. So again, if you build your foundation and you get the plumbing right, that should inform then in terms of how your data is structured and presented back. Again, it's it's not a straightforward answer, and every organization is going to be different. But again, it's I think the key piece of advice is that it's about having the foundation in play and a very clear strategy in terms of how you want to harness and utilize that data to your advantage.
And I see Tanya Mulcahy from the Health Innovation Hub Ireland has joined us, and she's apologising, but she was delayed joining us, but she'd like to know our thoughts on whether we in Ireland are hindering progress in development of tools and services informed by clinical data because of our rigid GDPR. William, maybe you might be the best place to start there.
Yeah, I wouldn't say hindering. I think when you look at the GDPR, I think it was drafted and written with the future in mind, right? And I think it is really setting standards high, and quite rightly so. Personal information. Again, everyone has a right to privacy, and I think it's really important. And I think look, you have to look at it in terms of how technology and security has evolved over the last 20 or 30 years. Some of the threats we're facing today weren't there 10 and 20 years ago. And I think the GDPR is in terms of ensuring that the data controller is protecting the data adequately. I think look, you can see from I suppose the risk that's out there. The cyber gangs that are attacking organizations every day of the week. Requesting ransoms. I think, for example, the HSE, when they had the cyber attack, the impact that had on patient care, which was really shocking. So I think I think we need to. There is a balance. You need to look at those risks, and I think the GDPR was written with kind of that right to privacy in mind. And look, if it wasn't there, I just think it would be like the Wild West, and things would be a whole lot worse.
From a fellow colleague, I see a question from Breda Kelly, question for Hazel. I'm curious to understand how you'd explain the importance of cyber hygiene to a senior clinical manager in the management healthcare management now and in the future.
Great question, and one that crops up every day, and it goes back to the language. So first of all, everybody's an individual. So it's really understanding not just the individual as a person, understanding what their business needs are. It is about having that empathic approach and building trust with that person. Sometimes, we have to, my advice is understand, what's in it for them and actually build on that. So it's about that. And William mentioned earlier, so one of the things that I've had to do, I've been thrown in completely in the middle. Hazel, facilitate the conversation in the boardroom. And when you have clinicians, technologists, and senior leadership, as well as, other, shall we say, O's, as they're called, CIO, CDIO, whatever the case may be. It's how do you translate that information and have it very clear. Now, I bring emotional intelligence into conversation. So whether that is something that I can, I profile people and help to understand kind of what their pain points are without actually on speaking to them. Now, this brings in more or less the behaviors that we have to understand from a psychological point of view. So in my experience, that there has to be a very, and I'll use the word again, empathic approach to understand or to help share what the impact is. And it's one of these delicate conversations that we know everybody's in it for the good of the patient, but it does take a little bit of love to speak to that person, understand the what and why behind it. And that's where that I really like to give a very bespoke approach and time to individuals because they're part of the team.
Absolutely, and you often see that the costs and the effort associated with digital transformation is just 18% for the technology, and the rest is change management and supporting staff and building that culture where they're open to change and working in a different environment. It's dealing with the people is where the fine work and the greatest effort and focus is needed. I'm conscious of time. I'm just wondering if any of the panelists would like to add some closing remarks before I close off. Yeah.
Just add to the GDPR there. Yeah, it is. Yeah, it has at least focused. Like it is a challenge for sure. You know, it's not. But as William was saying, it has focused people more on data security. You know, than they may not necessarily have been without it. You know, but it is a challenge. But I think it is kind of there for good reason as well.
Yeah, I think to kind of don't follow on from Donal's point, I think like, you know, it is a challenge, but look, you know, it's like anything, you know, the first day you go to the gym, it's a challenge, but the more often you go, the easier it gets, and I think, you know, it's, you know, rather than burying your head in the sand around this challenge, I think again it's about informing and empowering yourself, and you know, it will get easier the more you understand, the more you learn, and I think again, you know, I think as Hazel said, it's about being inquisitive, and having that curious mindset, and I think if you adopt that curious mindset, you know, that challenge or that hill won't seem as steep.
Absolutely.
Yeah, sorry, if I could just break. Yeah, absolutely. You stole my thunder there, William, about being curious, but it's absolutely true. I mean, when I'm asked, well, Hazel, how did you get involved in cybersecurity? I'm the first to say I did actually, if I'm allowed to use the word online, I actually bombed the CEO of the AMA, you know, conversation. Because I knew that there was something that I could bring to the table, and it was on the back of that I got introduced to people that got me involved. So yes, absolutely be curious. Look beyond the realms. Okay, Ireland is doing an amazing job in having conversations in Europe and with Orca and with Estonia and all of that. I'm saying, because I'm living here, that there are other, I suppose, opportunities to learn that little bit more, and then it's what I say about having the intelligence to apply what's applicable or what is good. So
thank you, Hazel. I'm conscious we haven't answered all the questions, but if any of the attendees wish to reach out to Emer O'Connell at universityofgalway.ie, she can follow up, or she can link you in with any of the panelists afterwards. I'd like to thank the panelists. I really enjoyed this evening, and I hope you did as well as the attendees. Recurrent themes were trust and data for me is a recurrent theme today. I think, Hazel, the comment of the day was that cyber hygiene is as important as hand hygiene. That's very catching and very appropriate. And I'm sure we're certainly on a journey, and it's very interesting and long journey, but we are there, and the awareness is there more so. And it's like, as William would have said, it's not if, it's when the next event will occur, and we will be prepared for that in due course. Yeah,